Okay, so I'm gonna quickly run through pre-op on a patient, so this will be a good resource to help you guys if you forget or need to run through it again. So I have my list of patients here, and I'm gonna go ahead and open my patient up. He's been checked in already, and I'm gonna go to PreOp doc. I'm gonna put myself in as the case attendee, and then choose my role just by hitting E, if I can find the E button. Next, and that will ask if I want to add it. Yes, I do. And then I'm going to say that my patient is here. And I'm going to go physically get my patient, and I'm going to bring them back to their room, and I'm going to go over this paper with the patient. And I'm going to fill out all of these. I'm not going to worry about the vital signs yet. I'll do that in a minute. So now I'm going to let them change into their gown. While I'm out here, I'm going to go into orders. And I'm going to, this may already be in if the pre-procedure, if the patient PAT call nurse has put it in already, but if they haven't, you'll have to go to the big add up here. Everyone should have this in their favorites. Just add that. It's going to be the doctor that's actually seeing them. This will be the only time you use the standing orders protocol. Close this box. I'm going to go ahead and initiate. And I'm going to come up to my LR here and click on that. I'm going to come down here and change it. I'm going to type in NS and choose the strip. Close my box. Come back down here and put in 500 for my amount, unless you're going to do the 1,000 bags, if you guys change to that. And then it doesn't really matter what your milliliter per hour is here. And then you're going to click somewhere out of that so it goes black. Anywhere will do. And then I'm going to orders for signature, sign refresh, the threesome that we always want to do when we do orders. And then I'm going to go to ad hoc, and I'm going to open up my pre-procedure checklist to make sure that you're going to endo first. And the most thing I care about on this first one is their last fluid intake, which was today at 0000, and I'm getting all of this from my paper I already filled out with the patient. Fluid intake was a couple of days ago. Their bowel description is clear, and they did the Go Lightly prep. This is the information that Kimba goes over with them about their asking questions and making sure that they're taking care of, patient advocate type stuff. Then we go to general, and all I really care about here is their chief complaint, which in my patient's case, you can see here, is nausea. He's really worried about being nauseous after the procedure, but he's here for a screening. But this chief complaint is that he's concerned about nausea post-sedation. Okay. And then this is going to be charting by exception. So if they're going home to, they're homeless, or they're going to law enforcement, which all our patients are, just kidding, or the psych unit, or they're going home to assisted living, then I might chart this stuff. If they're going home normally, regular patient, I'm not going to chart that. If they can't hear or they can't see, they're blind or something, I'm going to chart this, but otherwise I'm not going to chart that. And if they aren't speaking primary English, then I will chart this, but not otherwise. So on most patients, all you're going to be doing is that chief complaint and moving on. If they go by a nickname, you could put contact name, but you're really not going to ever open this to look for their nicknames, so it's not that super helpful. Then we're going to go to advanced directives. This should already come in. It does. No, they don't have advanced directives, and this is not yellow, so it doesn't have to be charted, but I'm going to say they declined information about it. Then we're going to go to allergies. They have no known allergies. That's what they said on their paper as well, so I'm going to mark that as reviewed. Medication. Now on this one, they're on all these meds. I need to make sure that I go to document med by history. And then I'm going to hold the control button down so that with my elbow, if I can, so I can choose the ones that I actually want to chart on. Oh, I just did what I always tell you guys not to. Don't click on the actual blue word, because that will open up an information about that drug. I don't care about reading about the drug right now. I just like to select it. So I'm going to select all these. I'm going to skip Coumadin so I can do that later. Right click in the blue somewhere, add modify compliance, and I'm going to come down here and I'm going to say still taking as prescribed, which has already come in for me. But I have a note here from the PAT nurse saying they are not taking it due to dysphagia. So I may change this actually to not taking. And we already have the reason there. And then I'm going to, that one's fine to go. So now I'm just going to do my Coumadin one. Right click on that, add modify compliance. And this one I'm going to say, oh, it already says held for pending surgery. But I do need to make sure that I say their last day was not today. They last took it on the 10th. And now that I'm done doing all my compliances, I'm going to do document history. And if you look, you will see that this has all been documented on now. Okay, now we're going to move on to problem history. I don't really do anything here but just glance at it because I'm not going to go to my patient and say, hey, do you have any problems? So I usually skip that for a minute, just glance at it a little bit. I'm going to go to procedure history and see if they've had any procedures prior. They haven't had anything I'm really worried about. When I hit this mark as reviewed, you're going to see that my data is going to come up here. Now I've reviewed it. Family history, their dad has Crohn's, which I have on my paper as well. I'm going to mark that as reviewed, and then you can see I reviewed it today. Social history, they are a never smoker. I'm going to mark that as reviewed. That will also say reviewed today now. Self-history, this comes over from your PAT phone call. This is where I'm going to worry about the problems that they have. So when I go through this myself, I will say, do you have any if this wasn't already filled out, I would say, do you have any neurological problems like stroke or seizures, cardiovascular problems like high blood pressure or stroke or heart attack, any respiratory problems like asthma or sleep apnea? Mine happens too. And sometimes when you click yes on some of these, it's going to open up boxes over here that you have to chart on. Had these not already been charted on, they would show up yellow. So you got to make sure there's no yellows left in your boxes. And you want to make sure that you hit the no first. This is going to say we're going to undo your charting. It's okay, I'm going to let it. So you hit if I were to say yes, they have sleep apnea or whatever I just said, and then I hit the no, it's going to get rid of my sleep apnea. So you want to hit no first and then yes on the ones that are yes. Now you can see I've opened up these boxes, which are still not yellow because they're still charted on. So we're going to go through all these questions, just say the general first two that are most common or whatever, so you can go through it pretty quickly. And then if you have time, your patient isn't going back right away, then I would come back to this problem history and add these yeses into their problem history, because their problem history is going to stay with them forever. So I would come in here and I would add sleep apnea, and I would add whatever else I found out here. They have seizures. I would add seizures. I would add blood clots. I would add all these yeses to my problem history because that will stay with them forever, where this self-history is going to fall off as soon as they're discharged. So that's why I like to do that. But this is important for us to be able to go through their health history. Then we're going to go to anesthesia. We only care about moderate sedation. Don't worry about charting this upper one unless you're a cluster doing surgical services or something. But for us, we only care, have they had prior sedation, any problems with their sedation. Then stop bang. My patient has sleep apnea. So these two questions are saying they've had a sleep study. This one is saying, yes, they have sleep apnea. They have a sleep study. They do not have sleep apnea. If they've had a study that confirms one or the other, you do not need to answer these questions below. But if they haven't, you do need to answer the questions below. So mine is going to say, yes, they have had a study and they do have sleep apnea. Now, even though I don't need to answer these down here, I am going to put in their height and weight here because it will calculate my BMI and it will also flow into other areas. So I like to put it right here. And that's already been put in because we were playing on this patient earlier. Normally it wouldn't be there. Even the PAT call doesn't put it in or anything. You would have to do it. I'm not going to worry about filling out these other questions because I already know they have sleep apnea. I answered yes. But let's say they don't have sleep apnea, so I need to answer these questions. Do they snore? Yeah, how about mine does? Are they tired? Everyone's tired when they wake up. Then you never have enough hours in the night. Has anyone said you stopped breathing? No. High blood pressure? No. And then this has calculated my BMI. So then this next question, is it over 35? No, it's not. Are you male? Yes, I am. And then we're going to go to this one. Are you over 50? No, I'm not. So I have 1, 2, 3 yeses. This would only be my 4th yes if their neck was large. So I'm not going to physically go and measure their neck. I'm just going to guess. Or some males will already know it from their dress size, their dress shirt size. Hopefully not dress size. But if it's my number 5 question, this is my determining factor if I get a 5 or not, then I am really going to go and measure their neck, because if I have 5 yeses, then I need to recommend that they go and have a sleep study done. And it's a paper that you need to send with them, so I will do that at that point. Then the ID risk screen, I'm going to say no, they haven't. This came over from PAT call. No, they haven't been out of the U.S. in the last 30 days, and this is your MRSA, C. diff, all of that stuff. Have they had any of those chronic infections, any fever, diarrhea? Just ask those very briefly. This is saying, have they had a fall in the last 3 months? No, they haven't. No secondary diagnosis. They don't use an ambulatory aid. Yes, they're going to have an IV because I'm going to do it. Their gait is normal. and they're oriented. That gives me my score, but even if they're 20, I still need to come down here and click a few things. I'm gonna have their bed in a low position, and I'm gonna have them oriented to the room. You can click a few others if you want to. You do need to say that they participated in their own fall prevention. Then DC needs, all I'm gonna do here is write their family member taking them home, which happens to be Anna in this case. You can put their phone number here, but I'm not gonna open this form back up to find their phone number. I'm gonna write it on the whiteboard, so I don't need to document it there if I don't want to. And anything else, none of the rest of this is really too important for our area. Again, unless they're going home, discharging to somewhere weird, then you could do that, or they're discharging with a walker or something. But that would usually be something new that they didn't come in with. Okay, then procedures, you need to be marking that they have their ID band on. Oh my gosh, I can't speak. Nothing new for you guys, right? And then that the site has been verified by the RN. And that's it for this. We're not doing consents or anything else here. Interpretive services, you only need to go to if you used interpretation to fill out this form. Vital signs I would not put in this form. And then I want you all to check progress notes, because here is where you'll see anything weird the PAT nurse noticed on the phone call. If they're like, really make sure that you verify their ride because it sounded fishy, or this patient has had a stroke so they slur their words but they're completely alert and oriented, or whatever. They can write a bunch of things here, so make sure you just check that. And then we're gonna go ahead and sign this because we're all done with it. Now on my little cheat sheet, you'll see that it says finish up checklist if any. So if there's something I forgot to ask about, so my checklist isn't quite done yet, I would be able to badge out in here and badge in their room, and then I could finish asking them the questions, finish documenting what I wanted to on here, and then sign it at that point. That's why that's there. But if you've got all your information, just sign it, you're done. And now I'm going to go in and I'm going to do my patient time. And I wrote that on the new one. So this is where I'm going to give them a blanket, explain the procedure, go over, do their IV, do their vital signs, go over everything with them, make sure they're comfortable. And then I'm going to come back out here and, or actually, while I'm still in there, I'm going to scan their IV fluid. So remember, scan barcode, look for your barcode. Here's my barcode. So I'm going to scan my patient. I'm not actually going to scan my patient, so I'm going to get put on the naughty list a couple of times. You're on the naughty list, yeah, it's okay. And I'm going to go ahead and give them one of my 5 NSs here. You're not scanning your fluid, you're going to be on the naughty list, yeah, it's okay. Pharmacist didn't look at your order, yeah, that's okay. We don't have a pharmacist here. And I'm going to put their IV in their right hand, and okay. This is going to stay open so I could add more meds if I need to give them Zofran or something at the same time, but I don't, so I'm going to sign this. And I'm going to come back out here to my computer, let them relax in their room, or they can go back to their procedure at this point if they need to. And I'm going to go over to iView, or Interactive View, I know.